I mean, it's only really a surprise if you have never seen my face before. I think it's actually more surprising that I've not made this video before. I think I thought I had, and I haven't. So, I have Ehlers-Danlos syndrome, hypermobility type, also known as type 3, also known as HEDS. So, for some background, the Ehlers-Danlos syndromes are connective tissue disorders, of which there are 13 types. I'm also going to refer to Ehlers-Danlos syndrome as EDS from this point forward, because Ehlers-Danlos syndrome is a lot of words and I can't be bothered. So, the 13 types are hypermobility type, classical EDS, vascular EDS, periodontal EDS, kyphoscoliotic EDS, spondylodysplastic EDS, brittle cornea syndrome, arthrochalasia EDS, musculocontractural EDS, classical-like EDS, dermatosparaxis EDS, myopathic EDS, and cardiac valvular EDS. Each type has its own genetic causes, genetic links, symptoms, manifestations, but something that is generally common across all 13 types is joint hypermobility, skin hyperextensibility, stretchy skin, and tissue fragility. From this point in the video, I will only be talking about hypermobile EDS, my type. I will be talking about the symptoms that I experience, how I got diagnosed, the Cliff Notes version, how it presents itself in my life, and some thoughts and feelings and general things about life with HEDS. I've just clocked my tan. I thought I put enough sunscreen on. I look ridiculous. So what are my symptoms? The first one, joint hypermobility. My Baton score is a 6 or a 7. Sometimes it's a 7, sometimes it's a 6. It depends on general pain levels and if I've hurt myself. So the one that is and isn't sometimes is the bending down forward and being able to put my hands flat on the floor. Sometimes because of other pain issues I'm not able to do it, other times I am able to do it, so it just depends on the day. I'm also hypermobile in other joints that are not on the Baton test, and even some joints that are in the Baton test, I'm hypermobile in different ways than the Baton test tests for. So the Baton test is not really a great measure of EDS, it's a good start, but I think there's more to go. So like these fingertips, not great, especially that one, say that. Can't really see it, but and then being able to like bend all of these, so like this one, it's quite bendy, and my hips are like forward hypermobile but backward not so much, and my toes, I talked about in the I got new feet video, when the doctor like examined my feet, he just like pushed my big toe and it's like, oh, just keep going, because I have hypermobile big toes. Another symptom that I experience is joint instability. My hips and my shoulders are particular bastards. They're not great. These guys like to show me up in meetings, so I'll be like leaning on the table and then there'll be like an almighty great crack. And everyone will just look at me and I'll be like, that was a shoulder, it's fine, carry on. And then hips, I always have issues with my hips. I also have something called snapping hip syndrome, which has links to hypermobility, but it's not part of HEDS, and you know, the usual fingers and toes that dislocate just on a whim. I also experience chronic pain, mild stretchy skin, so like some areas it can just keep going. The other side of my neck is still quite stretchy. Some places yes, some places no, which is sort of a hallmark for HEDS compared to like classical, you'd have stretchier skin. Chronic fatigue. I'm prone to injuries like repetitive strain injury, so this shoulder has had me signed off work twice in the 3 years I have been in the lab, because a lot of my job is this, and when I have like a lot of liquid in a pipette, like a 50ml, 100ml situation, that's quite heavy to hold at a distance. I also have velvety skin and looking young, which is not officially part of the EDS criteria, but like we all generally experience it. I think the tattoos now help, but I used to get ID'd all the time. I still do sometimes. I'm nearly 30. Easy bruising is typically a symptom of EDS. I used to bruise I used to bruise like a peach. I seem to have grown out of that one. I do still bruise, don't get me wrong, and some of the bruises I do get are dramatic compared to what bruised me. But it's not quite as bad as it used to be. I would say I bruise much closer to someone without EDS than someone with something like classic EDS. Unexplained stretch marks. I do have some resistance to local anaesthetic. This might be one of my least favourite ones because I went to the dentist last month to get some fillings done. And one tooth numbed up fine. The other one did not. So that hurt, that sucked. Dysautonomia is another symptom that I have of EDS, which is really fun that a symptom of a group of conditions is another group of conditions. But I have POTS and some other dysautonomia stuff, which I also don't really think I've made videos about. I've made one about POTS, but not the rest of it, so I think maybe I'll add that to the list. Nerve pain and nerve entrapment. I just sleep incorrectly some days and I wake up completely wiped out by it. I also get headaches and TMJ pain. I used to be so proud that I was one of the EDSs that didn't have a jaw pain issue because I hate the jaw pain. And then with all the dental treatment I've been having recently, I get TMJ now. Some places list anxiety and depression as EDS symptoms, and while yes, they probably are, I think in my case perhaps they're not just EDS related. I do have anxiety and depression and some other mental health stuff, as we know. I can pinpoint causes to those, so I don't think they are related to HEDS, but I do have them. That would be a box tick. Dental crowding and misalignment. My teeth. I am going to make a whole video about EDS and teeth with some like sciencey stuff, personal experience stuff, but yeah, my teeth have suffered because of EDS. And at the moment, having extensive dental work done, not having a good time. I do experience some gastrointestinal stuff. I think I'm just going to leave that to your imagination. That might be worse, to be honest. Constantly bloated. Always. Always. Chronic nausea, which is someone with emetophobia, not great. And I don't have mast cell activation syndrome. I made a whole video on that. It was a whole time. But I do have cold urticaria, which is why everybody says, oh, do you have mast cell? No, I don't, but that is a weird one. And some doctors that I speak to say that it probably is due to EDS. Some say, oh no, you're just that lucky. So we just thought I'd put it on the list just in case. Doesn't that all sound so fun? There are lots of other symptoms that people can experience with HEDS and all the other EDSs. That is also Googleable information. If I was to make a video on that, it would also just be me Googling stuff and repeating it back. I don't think it's super helpful, and also don't want to edit that. There are also symptoms of HEDS that I don't experience, so I can generally say that my spine seems to be okay and not super affected by HEDS. My heart seems fine, apart from being affected by POTS, which is sort of EDS, but like the actual heart structure itself seems fine. And everything that's wrong with my eyes, not to do with EDS. The eye manifestations of EDS tends to be nearsightedness. I have the opposite, so if anything I'm long-sighted, and visual snow syndrome is not related to EDS, it's its own thing. And astigmatism, kind of. Being deaf could be due to EDS, but it also could be because I had loads of ear infections as a kid and I grew up with loud cars and refused to use ear protection. My parents tried to make me, I would take them out every opportunity, and I really like loud music. If it's not loud, what's the point? Basically, my joints are loud, I live with chronic pain, I'm tired all the time, my teeth aren't great, and eating is harder than it should be. So how did I get diagnosed with this? This is the question of the century. How did I not get diagnosed with this, to be honest? So I'm going to give you the short version of my diagnosis journey. There is a long version. I don't think I'll ever really make that video because it's not actually that interesting. The short version is fine. So I lived with chronic pain since I can remember. I would always go like to my parents like, everything hurts all the time, or growing pains, and then eventually they took me to the doctor who also said growing pains. Sound familiar? And then when I became an adult and I was free to go to the doctor anytime I wanted to, I kept going back saying everything hurts all of the time. I was referred to rheumatology and they gave me like the trigger point test where they like squeeze parts of you and they go, does this hurt? And you go, yes, 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 no, yes. And he decided that I had enough tender points to get diagnosed with fibromyalgia. Fibromyalgia is a complicated one, and I'm 100% sure that the disease, fibromyalgia, does have a cause, biomarkers, and everything. It is a real thing, and I think it's a very specific thing. But I think it's being used as, you have pain and we don't know why. Fibromyalgia. So while that was a start, that was not a great start, because this misdiagnosis led to me being put on amitriptyline, which is an antidepressant that they use to treat pain sometimes. Talked about this before, but amitriptyline and coming off of amitriptyline worsened my visual snow syndrome to the point where I realised, oh, actually this is weird. If I had been listened to, I perhaps would have better vision than I do now. I knew that the diagnosis of fibromyalgia wasn't explaining the joint dislocations and the hypermobility, so I went back to my GP and I said, hey, I don't think this is fibro. I think this is EDS. Here's how I fit the criteria. Can I please have a referral? So then they referred me to rheumatology, and using the 2017 criteria, we went through it together and be like, actually, yeah, you do fit the criteria. I just want to rule out vascular EDS because you do have some symptoms that, you know, we should rule it out just to be sure. But yeah, if that comes back as no, I'm happy to diagnose you with HEDS. That is not a direct quote. I don't think any doctor has ever said, I'm happy to diagnose you with. I don't think, but that's the gist. So we used the 2017 criteria, which was a little bit controversial because it doesn't really cover the full range of symptoms. It's quite restrictive, and it also includes symptoms or signs that don't really have an impact on people's lives. So I'm gonna keep making fun of this one, but the heel papules that cause no problems, no pain, but things that do have an impact, like nausea all the time, anything to do with GI symptoms, dysautonomia symptoms, doesn't mention anything to do with the spine. You know, it misses such a huge chunk and then focuses on really specific things that make it, you do risk underdiagnosing, and I believe it's leading to false classification of EDS as a rare disease. This can have huge impacts on funding, treatment, resources, training, understanding of EDS as a whole. If something affects a larger amount of the population, it gets more funding. So like cancer affects a huge number of people, whereas like rare diseases, not so much. Anyway, so the criteria has 3 main criterion, but one of them has 3 subsections, of which you need 2. I don't know why they didn't just make it like 5 criteria and you need 4. So the first one is the Baton score. It's age adjusted, so as you get older you tend to get less hypermobile. So it's adjusted for age, and mine's always been 6 or 7, as we discussed earlier. So I fitted that as a kid and I fit that now. And then if you are 1 point off, there's like another criteria that means you can still have criteria 1. For example, it's like, do you describe yourself as double jointed? As a kid, were you always showing off at parties by being super flexible? That kind of thing. I was that kid that always showed off for being super flexible and double jointed and like contorting myself into like weird positions. So yes, tick that one. So criteria 2A, you have to have at least 5 from a list of 12. I had soft skin, mildly stretchy skin, unexplained stretch marks, considering I have been underweight pretty much my entire life, heel papules, abnormal scarring, and dental overcrowding. So that's 6 out of 12. Section 2B is a family history of either a diagnosis or somebody meeting the criteria. And this one is difficult for me because I'm estranged from most of them. So I don't think we included this one, we just sort of like, well, yeah. But luckily for me, you can still pass criteria 2 if you don't meet feature B. So criteria 2C, you have to have, it's about pain. So you have to have 2 or more joints experiencing musculoskeletal pain for over 3 months, chronic widespread pain for over 3 months, or recurrent dislocations without trauma, which I tick off because pain and dislocations. And then criteria 3 basically requires that your symptoms are not better explained by something else. This is where the whole like fibro discourse comes in, because fibromyalgia we know doesn't cause dislocations and hypermobility. But does it explain the pain? Perhaps it does. It's a whole thing, needs more research. Like, really needs more research. But yeah, we decided that if we just ignore fibro for a minute, we take it as it is, it could be a misdiagnosis. If I didn't already have that, does anything else explain it, including other types of EDS? No, not so much. But then we were going to send off for genetics just to make sure I didn't have the vascular type. And then, yeah, as he said, he referred me to genetics, and genetics said no. Not no, I don't have VDS. It was no, we don't take hypermobility referrals at the moment because it's so popular. Right, okay. Luckily I don't think I have any reason to believe that I have vascular EDS. So, okay, whatever. But then I was in diagnostic limbo for a little bit because I was discharged from rheumatology, because HEDS, it's, well, any EDS really, it's not really a rheumatologist problem because there's no cure, there's not really like treatment to stop it getting worse or better. It doesn't need to be managed by a rheumatologist. So he was like, yeah, cool, if this yes, if this yes, in a letter, off you go. And it was ages until I got that letter. So I was in diagnostic limbo. Eventually I took the letters to my GP and like, just look at them. Can you just write it down somewhere? Because he'd very helpfully put in writing that yes, fits the criteria for hypermobile EDS, referral to genetics to rule out VEDS, if results from genetics come back no, diagnosis of HEDS. But because he had discharged me, it never made it onto my records from him, so then I had to take it to my GP and be like, look, take it, can you please write it? And I had one GP that was just like, we can't diagnose you with this. I'm like, but you're not, you're just reading and putting. So then I went to another GP when I moved, and I was just like, paper, and they were like, oh yeah, easy. So that was a thing. And then it was also, there was also times where I went to like the allergist shortly after my appointment, and it was already in my notes there, but it hadn't made it into like my summary care patient thing. So when I moved, there was like nothing there, and it was on some clinic letters but not other it was a mess. Interestingly, a study by Ritelli et al. In 2024, they found a potential biomarker for hypermobile EDS that with astounding accuracy could differentiate it from other rheumatological disease things like osteoarthritis, rheumatoid arthritis, psoriatic arthritis, and other types of EDS. And the accuracy on it is almost too good to be true. So I'll be keeping an eye on that, and I'll definitely, if that becomes a test, I would definitely be asking like, can I have it please? Because it would be good to know. I think anyone with a clinical diagnosis that then gets its own diagnostic test, everyone should have access to that test, because it's very important to know what is actually wrong with your body. So how does EDS affect my life? Generally, pain and fatigue have the biggest impact. Fatigue makes it hard to get out of bed, to go to work, to go to an event, to get anywhere. And then the pain makes it hard to be wherever I am. That's just my experience of it. So I'll wake up super tired, not really want to wake up to go to work, but obviously I have to, so I do. And then I get to work and I'm just like, pain. I can be tired to the point where I'm about to pass out. I can be lying down in this very nice bed of mine, and I'd be so tired, ready to fall asleep, but there is so much pain, I cannot do it. And I end up tossing and turning and just trying to find a position that is comfortable enough to actually sleep in. Likewise with tachycardia, it is not a pleasant experience when you're just sitting down. So I had a running phase, you might have seen it on Instagram. I started running a little bit. People with EDS can run, I cannot, we've learned this. But like the increased heart rate after that felt sort of good because I had been doing a sport. I was also out of breath, I had the endorphins from the sport, and that was fine. But when you're just like sat down and your heart's like, and you're just like, oh my god, am I dying? You're just like, it's horrible. Sometimes the dentist can't get me numb and we just have to do it. Having crooked teeth and misaligned teeth, it's not just an aesthetic thing. So I had braces for like 5 years and most of my teeth have just moved back to how they were before, especially my bottom ones. But like aesthetically, don't care, but it does make it really difficult to clean your teeth properly because you can't get everywhere. And like with a toothbrush, with dental floss, even like mouthwash, there are some places it just can't get to. I don't really mind the soft skin or the papules. I do mind the nausea. So how do I manage it? I do my best. I reserve painkillers for really bad days because painkillers do have side effects and risks. So like if you take ibuprofen all the time, your tummy might not be so happy about it. So if I'm just like at home playing video games, I can do that in pain. If I'm at work doing an important training session, I'll probably take a painkiller if I need to. It's reserved for like really bad headaches, jaw pain, and times that I just don't want to be in pain. So if I've paid money to go to a concert, I'll probably take a painkiller for that. I took painkillers when I went to go ride on the Zeppelin because I woke up with a huge headache that day and I was busy, I had stuff to do. So I took a painkiller so that I could enjoy my Zeppelin flight. I'll put a link somewhere up here if you want to go see about my Zeppelin flight. Why let pain take experiences from me if I don't have to? State of that, that's normal, that's mine. That's a normal one. That's mine. I've got too much going on in the background. But then if you like put it down somewhere, that's normal, that's mine. So I rest a lot. I spend a lot of time in bed physically resting, even if I'm not mentally resting. And making YouTube videos isn't really physically demanding for me. I can sit here for 20-30 minutes, film, make notes, and it's not that bad because I'm sitting. If I was doing a running vlog, that would be different. I also talk about it a lot, not for sympathy or anything like that, but I just find it's very helpful in getting people to understand why I might be asking for help with something I could do yesterday. People just, like if I just pull up chairs all the time, and like if I need to ask someone for their seat or if I need to make an adjustment, people understand why I'm asking. It's not just like, oh, I didn't know that you had a disability. Oh no. Then people just know and they're just like, oh, okay, yeah, sure. If there are things that are within my grasp that I want to do, I won't let it stop me. So being a scientist, yes. Ultramarathoner, no. That's not within my grasp at all. I've also managed it with various mobility aids over the years. So when I was like 17, I started to use a walking stick. I continued at university for a bit. I've used crutches, I've used a wheelchair, I considered a walker but never tried one. And now I mostly use my bike as my mobility aid, and yes, it is a mobility aid because I can go way further on a bike than I can walking. Walking for 30 minutes ends up in excruciating pain. Cycling for 30 minutes, I'm then a person on the other side, so I could walk to the train, get the train to work, and walk from the train to work. I could. I wouldn't be well off on the other end. I could just cycle and not be in as much pain. And also, no, I don't bring it inside and ride it inside. Are there any positives? Kinda, yeah. I think sometimes being able to contort into weird spaces can be quite helpful. Like if you drop a very expensive bolt and it goes somewhere weird, I can just like snake my little hand in and go get it. It's also given me a wonderful community of fellow EDSers to talk to about it, which is great. it also forced me to learn how to advocate for myself, which is a very valuable skill and one that I have found particularly useful. I think also the joints for me generally go in as easy as they came out. So I don't end up just in hospital all the time every time something pops out. If you're quick, you can get it back in by yourself. That's just me. There's also a good chance that it's partial dislocation, not a full dislocation. Without an x-ray you won't know. Popped out is popped out, I don't care. But it's not like a one-way street. If it pops out, I'll pop it back in. Is there anything I really hate about it? Yeah, I hate seeing people that also have HEDS become no longer with us. That sucks a lot. And then obviously the inaccessibility of spaces in general also sucks. So when I was using a wheelchair, the amount of things I couldn't do just because I couldn't get in the building was not great. And I think there's weirdly this like stigma about having HEDS now. God knows what that's about, but it's unfortunately it's there, which is annoying. And just like a lack of awareness and, you know, proper diagnostic criteria that actually is accurate. Why classify something as a rare disease if it's not? Like, I don't understand the point of that. Oh yeah, and pain. Did I mention pain? That sucks. That's a downside. Yeah, I think that's about it. I think that's about all I can cover on EDS today. That is just my life, how I live it. May is also EDS Awareness Month, so happy EDS Awareness Month. If you liked this video, drop a like down below. If you have any questions about my experiences with EDS, put them down in the comments and maybe I will follow up in a video. Subscribe to my channel if you haven't already and ring that notification bell so you get notified every single time I post a new video. Videos go up once a month, somewhere in the middle-ish. I aim for a Saturday 6 PM. Sometimes I miss. See you.